How Achalasia cardia is diagnosed? Achalasia cardia diagnosed based on three important tests: endoscopy, barium study and esophageal manometry. Endoscopy is the first investigation usually done by endoscopist, where endoscope, that is a small 1 centimeter tube which has mounted camera and light with suction at the tip, will be passed from the mouth, that will go through the food pipe and give the pictures of the food pipe, lower esophageal sphincter and also stomach, which can be seen on the monitor by the endoscopist. In classical case of achalasia, you will have a dilated esophagus with lot of food residue in the esophagus, and endoscopist will have their resistance at the lower esophageal sphincter to open up, and also he can visualize the stomach for any associated disease. Endoscopy basically not meant for diagnosing of achalasia. It is not very good for diagnosis of achalasia, because early kind of achalasia will be missed on endoscopy. But endoscopy is meant to rule out other problems such as stricture, such as cancer at the esophagus or GE junction can be ruled out better by the endoscopy. Once endoscopy is done, next investigation usually done is barium study. Barium study is nothing but a chalky white fluid, a dye will be given by the radiologist to drink by patient. While we swallow that fluid, he will take sequential images on the fluoroscopy or X-ray machine. That images will be captured in such a way that how the flow of barium dye happening in your food pipe, how easily it is going into the stomach, is there any hold up of the dye at the lower esophageal sphincter, that is junction of stomach and esophagus, how much dilated esophagus can be seen. In classical case of achalasia, we will have dilated esophagus with bird beak appearance of lower esophageal sphincter, that is classical of achalasia on barium study. Third most important test, and that is mandatory to be done, is high resolution manometry. High resolution manometry done by the physician, where they will pass small half centimeter tube from the nose which goes across the food pipe into the stomach. They will actually mean to see the sequential pressure changes happening in your esophagus, upper esophageal sphincter, body of the esophagus, lower esophageal sphincter and also stomach, where they will calibrate all these things during the process of swallowing of the liquid, so that they can titrate, they can interpret the graphical representation of pressure waves and pressure changes in the esophagus different parts. Based on the graphic representation and values, the physician gives, is it the Achalasia cardia or something else, and also it is mandatory to classify type of achalasia based on the pressure changes in the esophagus in case of achalasia. The Achalasia cardia based on the manometry, three type will be given. Those are important to decide type of surgery to be done, and also it is important to explain the prognosis to the patient. One of the other tests usually done in old age, more than 50 or 60 age, that is CT scan, CT thorax and abdomen, to be done by the radiologist to rule out cancer in this patient. There is something called pseudo-achalasia. Patient will have endoscopic achalasia, manometry of suggestive of achalasia, but it is due to some tumor of stomach, something from the pancreas, some lymphoma, which will present like pseudo-achalasia cardia. It has to be ruled out in old age by doing CT scan.